The cardiovascular system consists of the heart, which is a muscular pump, and the blood vessels. The vessels are arranged in two continuous loops, the pulmonary circulation and the systemic circulation. When the heart pumps or contracts, it pumps blood simultaneously into both loops. Hello, this is Susan Knowles from Cochise College Nursing, and welcome to this podcast, which is an introduction to the cardiovascular system, some anatomy and physiology, as well as the blood flows. When the heart pumps or contracts, it pumps blood simultaneously into both loops, the pulmonary circulation and the systemic circulation. And this diagram demonstrates that activity. I'm going to discuss the different structures of the heart before we talk about blood flow and how it travels through the heart, depending on whether it's deoxygenated or oxygenated blood. First, up here as you're looking at the slide, you're going to be seeing up here in the far left-hand corner, you're going to see the superior vena cava. Both the superior vena cava and the inferior vena cava will enter the heart up in this location. The superior vena cava will bring in the deoxygenated blood from the upper part of the body, whereas the inferior vena cava will bring in blood from the lower part of the body. The next structure you'll see is the right atrium. The next structure identified is the pulmonary trunk, and when we get to the other side of the diagram, you'll see that the pulmonary trunk actually is the beginning of the pulmonary artery. We next see the pulmonary valve, which is where the blood, before it is oxygenated, will travel through to go to the lungs. We next see the aortic valve, the right AV valve, which is actually the tricuspid valve, the right ventricle. Up in the far right-hand corner, you're going to see the other systemic vessels which come off of the aorta that are going to take oxygenated blood to the rest of the body. Then we see the aorta, the pulmonary artery, which, as I had mentioned before, it began as the pulmonary trunk, followed by the pulmonary veins, which will take the oxygenated blood back into the heart. We have the left atrium, followed by the left AV valve, which is actually the mitral valve, or sometimes called the bicuspid. And finally, the left ventricle. Just to review some of the anatomy of the heart, remember that the heart is a hollow, muscular, four-chambered organ with a septum dividing its two sides. It's about the size of your fist. It's located in the mediastinum and suspended by its attachments to the great vessels, both the aorta and the pulmonary artery. The shape resembles a cone. Its lower narrow border is known as the apex, and it's located near the left fifth intercostal space at the midclavicular line, and it rests on the diaphragm. Its upper broad border is known as the base. So this is the opposite of what we normally think of. And it's located at the right sternal border at the level of the attachment of the third rib. The heart is divided into four chambers, the right and left upper atrial chambers, and then the right and left lower ventricular chambers. The pericardium is what the heart is completely enclosed in. It's enclosed in a tough, membranous sac. It's loose fitting, and it protects the heart from trauma and infection. And it actually has two layers. It has the inside and the outside layer. The parietal pericardium is a tough, fibrous outer membrane, and it's attached anteriorly to the lower half of the sternum and posteriorly to the thoracic vertebrae, inferiorly to the diaphragm. The visceral pericardium is a thin inner layer, and it closely adheres to the heart and to the first several centimeters of the pulmonary artery and aorta. The pericardial space is between the visceral and parietal layers. The heart has 4 valves, and they are flexible, fibrous, unidirectional, which allows blood to flow through the heart in only one direction. They open and close passively depending on the pressure gradient in the chambers. The AV or atrioventricular valves separate the atria and the ventricles, and they open during ventricular filling or diastole. During the pumping phase, they are shut to prevent regurgitation back into the atria. The valve leaflets meet and unite to form a perfect seal. Of course, that's in a perfect situation. The right AV valve is the tricuspid valve, as I mentioned before. Of course, it's on the right side, and it has 3 leaflets. The left AV valve is the bicuspid or mitral valve. Of course, it's on the left side, in between the left atria and left ventricle, and it has 2 leaflets. The semilunar valves are found between the ventricles and the arteries, and they're open during pumping or systole to allow the blood to be ejected from the heart. There are no valves between the vena cava and the right atria, or between the pulmonary veins and the left side of the heart. And this is why when there is an abnormally high pressure, we will see signs and symptoms in the patient. If it's on the right side, the patient will have signs and symptoms in the neck veins as well as the abdomen, and on the left side, we will see pulmonary congestion. The aortic semilunar valve is between the left ventricle and the aorta, whereas the pulmonary semilunar valve is between the right ventricle and the right pulmonary artery. Now on this slide, we're going to talk about how the blood flows through the heart generally, and we'll probably go through this several times. Deoxygenated blood is carried from the body through the inferior and or the superior vena cava. From these vessels, the blood is dumped into the right atrium of the heart. The atria serve as preliminary holding chambers or for the main pumping chambers, which are the ventricles. The atria hold the blood on standby before it is pumped into the ventricles. Blood from the right atrium goes into the right ventricle. From there, the blood is pumped to the lungs via the pulmonary artery to get oxygenated. Once the blood is oxygenated in the lungs, the blood returns to the heart via the pulmonary veins. It is dumped into the left atrium, and from there, the blood is pumped into the left ventricle. Then it is sent out to the body via the aorta. The blood then travels through the body, oxygenating and nourishing the tissues, and then it returns to the heart where the cycle starts all over again. Remember, as the blood leaves through the aorta, it goes into the arteries, the arterioles, and then into the capillaries. Once it gets into the capillaries, this is where there's an exchange for the oxygenated to the deoxygenated blood. It's picked up into the capillaries, then in the venules to the veins, and then once again it travels either up from the lower part of the body into the inferior vena cava, or from the upper part of the body into the superior vena cava, and then it starts all over again by being dumped into the right atria or atrium. Let's review blood flow as it comes from the lower part of the body. Let's follow a deoxygenated red blood cell coming from the lower part of the body. It's being drained downstream into the vena cava. It's swept along with the flow of venous blood, and it follows the route illustrated in the diagram. From the lower part of the body through to the right atrium from the inferior vena cava. Remember that the blood from the head and upper extremities comes through via the superior vena cava. From the right atrium, venous blood travels through the tricuspid valve to the right ventricle. From the right ventricle, venous blood follows through the pulmonic valve to the pulmonary artery. The pulmonary artery delivers unoxygenated blood to the lungs. The lungs oxygenate the blood. The pulmonary veins return fresh blood to the left atrium that has been oxygenated. From the left atrium, arterial blood travels through the mitral valve to the left ventricle. The left ventricle ejects blood through the aortic valve into the aorta. The aorta then delivers oxygenated blood to the body. The circulation is a continuous loop. The blood is kept moving along by continually shifting pressure gradients. The blood flow from an area of high pressure to one of lower pressure. The rhythmic movements of blood through the heart is called the cardiac cycle. It has two phases, diastole and systole. In diastole, the ventricles relax and fill with blood, and this takes up to 2/3 of the cardiac cycle. The heart's contraction is systole. During systole, blood is pumped from the ventricles and fills the pulmonic and systemic arteries. This is 1/3 of the cardiac cycle. Going back to diastole, this is where the ventricles are relaxed and the AV valves, both the tricuspid and mitral, are open. The opening of the normal valve is silent. The pressure in the atria is higher than that in the ventricles, so the blood pours rapidly into the ventricles. The active filling phase of the ventricle from the atria is called atrial systole or the atrial kick. And that will become important later when we start talking about abnormalities of the heart. Remember that the ventricles are in diastole, or they are relaxed. Once more of the blood has been pumped into the ventricles from the atria, the pressure is higher in the ventricles than it is in the atria, so the AV valve shuts, or the AV valves shut. Both the mitral and the tricuspid valve shut. This is S1, or the first heart sound that we hear. Looking at the left side of the heart, the pressure exceeds the atria, so the aortic valve opens and the blood is ejected rapidly. Once it is ejected, the pressure falls and the aortic valve swings shut. And this is closure of the semilunar valve. On the right side of the heart, we have the blood going through the pulmonic semilunar valve, and once the pressure changes there, both semilunar valves will shut. This is the second heart sound that we hear. This is also the end of systole. All four valves are shut and diastole begins again, or relaxation. However, meanwhile, the atria have been filling again, so the events on the right side are just a bit behind the left side, as the pressure levels are lower on the right side than they are on the left side. And this becomes important if you hear a slight sound splitting of the sound of S1 and S2. Sometimes you'll hear a little split in S2 because the valves shut just one behind the other. The left shuts just a bit before the right side shuts. So sometimes you'll hear about an S2 split. You don't need to get concerned about this at this point. It's just so that you have this for background information. In the resting adult, the heart pumps between 4 and 6 liters of blood per minute. Cardiac output equals the volume of blood ejected with each contraction times the number of heartbeats per minute, or the rate of heartbeats. The heart's compensatory mechanism is to alter its cardiac output to adapt or compensate to the metabolic needs of the body. Preload and afterload affect the heart's ability to increase cardiac output. Preload is the venous return that builds during diastole. So it's the volume of blood in the ventricle that causes the ventricle to stretch. And if you can think of a rubber band or a slingshot, and you pull back on a slingshot or a rubber band, and of course you've got to think about this rubber band being a new rubber band, so you pull back on this rubber band and you increase the stretch of it, which then when you let it go will increase the force of the blood being ejected from the heart. Well, that's in the normal situation. That's called the preload. It actually is according to Frank's Starling law that the greater the stretch, the stronger the heart's contraction. This increased contraction will force more blood out, which then increases the stroke volume. Afterload is the opposing pressure that the ventricle must generate to open the aortic valve against the high pressure. So afterload is actually the resistance or pressure. It's not volume, whereas in preload, it's the volume that causes this stretch or this power, whereas afterload is the resistance. If you can think about, the blood now has to push through that aortic, if you're talking about the left side, the aortic valve to push into the aorta to go along with the blood that continues to circulate out to the rest of the body. So the left side of the heart has to push through this resistance. And when we start talking about disease processes, this is where we'll be talking about diseases affecting both the preload and the afterload. And as we know, once the aortic valve is open, we have rapid ejection of blood out into the systemic circulation. And if you look at the diagrams on this chart that I have, or this slide that I have up there, you can kind of see what I'm talking about when I talk about preload. You can see in the preload diagram how it's demonstrating this stretch of the ventricle. And if you look at the afterload, it's showing the blood being pushed out through the valves. It's really hard. Well, you can see the arrows kind of showing that there is pressure coming out specifically of the on the left side of the heart. In the aorta, you got pressure coming down the aorta versus pressure from the left ventricle trying to push against that to get that blood out, and that's afterload. Just to review the additional portions of the circulatory portion of the heart, we have our oxygenated blood leaving the heart through the arteries, traveling from the arteries through the arterioles, and then into the capillaries where the blood is, the oxygenated blood is taken to the tissues. And then we see at the capillaries it taking up the deoxygenated blood and passing that deoxygenated blood to the venules, to the veins, carrying it back up to the heart either through the inferior or superior vena cava. Now, how about circulation to the heart itself? Both the right and left coronary arteries branch off of the aorta to supply the heart muscle with oxygen-rich blood. These two arteries branch out of the aorta immediately after the aortic valve. The right coronary artery splits into the marginal branch, which then feeds blood into the right ventricle, and the posterior intervertebral branch, which supplies the left ventricle. The left coronary artery is notably larger than the right coronary artery because it feeds the left heart, which, as a result of its more powerful contractions, requires a more vigorous blood flow. The coronary arteries are especially subject to blockage and narrowing, which can cause a depletion of blood to certain parts of the heart, possibly causing a heart attack. Most myocardial perfusion occurs during the heart's relaxation or diastole when the subendocardial coronary vessels are patent and under low pressure. This also contributes to the filling difficulties of the coronary arteries. This completes this podcast on myocardial blood flow. Please join me on another podcast in the future. Thank you. This is Susan Knowles from Cochise College Nursing.